Inside the Deal, Healthcare VCs to Watch. I'm Carrie Nixon, and I'm the founder and the managing partner at Nixon Law Group. We are a boutique law firm, and we're focused on healthcare innovators who are building the future of care. This video series spotlights investors who have proven to be truly valuable partners to founders in digital health and healthcare technology. So today, I'm really pleased to be joined by Stasia Obremskey, the managing partner of Foreground Capital. And it is a VC firm that invests specifically in women's health companies. Stasia, thank you so much for talking with me today.
Very nice to see you and delighted to be here. You're going to ask me questions about my favorite subject, which is what are the innovations going on in women's health?
Excellent. I can't wait. So, Stasia, I know that starting your own fund is no joke. It has to be an incredibly heavy lift. I'm interested in, apart from the obvious, was there any particular trigger that motivated you to say, hey, we really need a VC firm out there that is solely focused on companies that are supporting women's health?
I would say there wasn't one trigger. I would say there were many things that came together at a certain point of time, which made it clear that this was to be my destiny. I call this my dream job. I wasn't born a venture capitalist. I came to this work from, I would say, a pretty circuitous path, but one that I think all added up to me being able to do this job as the managing partner of Foreground Capital. I started my career on Wall Street as an investment banker, went to Harvard Business School, joined Bain. With the through line through all of that is really a commitment and an experience in the healthcare sector. I spent a number of years in the public health sector, living in Asia, again, using my capital toolkit, but in the public health sector, focused really on reproductive health, family planning, HIV/AIDS, and then came back and became the CFO of startups in the Bay Area, particularly in the healthcare space. So I would often work with the senior management team, setting up their accounting and finance functions, and then helping them raise their seed or Series A round of funding. Once they had that funding in place, would sort of help set up their finance and accounting team and sort of move on to my next client. So I had been on the other side of VC. I have been an advocate, investor, and philanthropist in the women's health space for 30 years, both domestically and internationally. So when I met Dr. Ruth Shaber, who was a philanthropist in the space, but given her clinical background and experience at Kaiser, recognized that innovations are really funded by equity, not grant funding, and really wanted to be involved in setting up a venture fund focused on women's health, and asked me to join as an investing partner. As I said, that was an opportunity to combine my avocation with my vocation and really work to build a company focused on innovations in women's health.
And what a great thing to have, a foundational investor be a physician who really focuses in this area and knows it well.
Exactly. And I think Ruth clearly recognized all the unmet needs that were out there across the women's health spectrum. And again, as a business person as well, recognized that it was early stage equity capital that was really going to fuel those innovations. Shortly after meeting Ruth, I met Elizabeth Bailey, who became my co-founder and co-managing partner of our predecessor fund, which was RH Capital, Fund 1 and 2, and now our independent, wholly owned fund, Foreground Capital. And Elizabeth came to the work with a much more traditional venture capital background. She helped build one of the first socially responsible impact venture funds in the 2000s in Boston, and her focused on the health and education portfolio. So was always astounded in that role that there weren't many women's health investment opportunities. And the one or two that she found, she had a very hard time assembling a syndicate and getting other co-investors involved in it. And this is, again, in the 2000s, where there weren't many women in VC. And 20 years later, as she sought to sort of re-engage in the venture community, was excited that there seemed to be both capital and investors who were now looking at the space and really understanding the potential impact and the financial returns that were there.
Yeah, long overdue, for sure.
Long overdue.
But here we are now. So, okay, let's focus for a moment on the impact investing aspect of this. So, what does impacting investment mean to you in practice? And how do you sort of evaluate whether a company is actually delivering both returns and impactful outcomes?
Great question. So we we say that impact is like a Rorschach test where it means different things to different people. And when we describe our fund as an impact forward fund, but then we quickly say, but we're looking for market rate returns because we don't think mission and money are mutually exclusive and that we can do both simultaneously. And the way that gets implemented in our fund is that we've developed 4 pillars around, and our impact North Star is really around health equity. And we define that along four pillars. One, what things are truly transformative and are going to be game changing to this current standard of care. Secondly, what things are really going to increase access to care, particularly for communities either geographically or racially that have been underserved. What kind of innovations are going to increase affordability, both to the perhaps the individual customer, also to the system. And lastly, what innovations can really address the systemic bias, which we know exists in the healthcare system, either along gender or racial lines. So our first screen when we meet a company is, does it meet one of those 4 impact pillars? Is it truly transformative? And if so, how? How does it differ from the current standard of care? Does it increase access? Does it address Medicare communities? Is it a technology or a service that can be paid for by not only public but private sector, or not only private sector but public sector funds? Again, around affordability and then around systemic. And if a company, again, we call it spikes on one of those 4 pillars, then we move to full due diligence and we take a financial lens, and we do the typical due diligence that any venture fund would take. Now, how that then gets integrated into the rest of our process is we work with the founders, both at the beginning and during diligence, to really identify what would be the the KPIs related to how we're going to measure impact. How do we define impact? And then we annually track those and we report on those. So we're just about ready to release our 2024 impact report, which really looks at a portfolio level and then across the portfolio, what kind of impact we're having, again, across those 4 pillars. So it's really embedded all across our investment process. And we think it's one of the things that really differentiates us from other funds. And so you'll find companies in our portfolio, again, that serve particularly in the maternal health space, serve large Medicare populations. Yes. You'll find companies whose services are really what we call culturally congruent. They're tailored to the population that they're serving, both in terms of the people who are actually doing the provision of care as opposed to the materials that are being, appropriately shared with them. And so those are the kind of companies where we really think are promoting our health equity North Star, as well as our financial North Star.
Yeah, that's fascinating. So, it's a high bar, right? A company has got to be not only focused in women's health, but also very specific metrics around impact that you all are looking for. So
we have the high bar. I would say we have a robust pipeline, and we see a lot of companies that are able to achieve both those things. Some sectors versus others. For example, the fertility space, it's been more of a challenge to find companies which really meet those impact and financial. And we see a lot of deals in the fertility space. We do have 2 companies in our portfolio. And again, because of the services or the science that those companies are working on, we truly believe that they can have a strong health equity impact. But there are some that don't. And those, we don't look at. But as I said, even though we have that screen, the pipeline is still very robust.
Well, you've just talked a lot about some of the metrics that you all look at and the importance of those metrics. I think it's fair to say that the investment landscape for women's health companies has matured significantly in recent years. I'm interested, are there other key metrics and things that you look at during a due diligence process that may not have really been relevant 5 years ago?
Oh, that's a good question. So I think the top of the list right now would be the macroeconomic political risks that we're living in. It's what a difference a year makes. A year ago, we had a lot of tailwinds in the women's health space in terms of policy and governmental support. A year later, all we have are headwinds. And so we are now actually underwriting risk a little bit differently in that we are asking questions about what will some of the regulatory changes, how will they impact? I mean, we're always interested in the regulatory risk, but there are some now added risks around substantial reductions in workforce in some of the agencies that we work with. How's that going to increase time to decision on a pivotal or a phase 3 trial?
Yeah.
Time to regulatory approval. We're all awaiting how the one beautiful big bad bill will impact Medicaid reimbursements. Pregnant women are protected in some sense. They're not subject to the work rules. Those coverages still exist for pregnant women and women 12 months postpartum. But how's that actually going to funnel down into the state level where those programs are actually implemented? Will we continue to see doula care reimbursed? Will we continue to see midwifery, covered under some of those Medicaid programs at the state level? And those are just big unknowns that, again, didn't exist 5 years ago, but in this particular time and this particular administration are sort of a new level of risk that we're thinking deeply about as we underwrite companies for investment.
Yeah, that makes a lot of sense. And, threats to reproductive freedom and rights as well coming into play. Just a lot to consider on that front, unfortunately. Well, I think it's probably also fair to say that most women's health founders are very mission driven. And I wonder if they sort of often struggle to balance purpose and impact with profitability. You've touched on this a little bit earlier, but I'm interested in sort of what advice that you give to women's health founders who are, trying to earn investor confidence around profitability, but also staying true to their mission to really drive impact.
Yeah, I think my advice to them would be, think about your customer and not just a single version of that customer, but all the different versions of that customer, what she might look like, and think about a business model, building a fit for purpose business model. For example, if that customer is most likely to be a Medicaid payer, fall into the Medicaid system in terms of reimbursement, how might you think differently about your business model in terms of your unit economics, because it's most likely that reimbursement rate will be lower than the private sector rate. So from the start, and we have a great example of a company in our portfolio called Seven Starlings, which focuses on maternal mental health. And again, from the beginning, the business model was a group therapy, mental health sessions. They offer a full range of services, but the most popular is the group model. They do individual counseling, and then they do medication management as part of a mental health, behavioral health platform of services for pregnant and postpartum women. Mm-hmm. It actually turns out that new mothers feel very isolated, and they like being in a group setting, whether they are paid for by private insurance or whether they're paid for by Medicaid. So in that case, the company built a business model which wasn't fit for purpose necessarily for Medicaid, but it was perfect because of the unit cost economics, so that it could easily be transferred from a commercial pay customer to a Medicaid pay customer. The other thing they did, which was very smart, is that they recognized that this is a pain point for physicians, because when you go into your OBGYN 6-week postpartum visit with your OB, she's supposed to do a mental health screen for you. Mm-hmm. But a lot of them are reluctant to do that, because if they do the screen and you need mental health services, they don't have any tools or services to help you. They don't prescribe, mental health medications. If they refer you to a therapist, it'll be a year if you're lucky to be seen, and you need help right now. And so Seven Starlings can really, they can refer the patient to Seven Starlings. They can get into a program within the next week to 10 days, and they can get the behavioral help that they need. So it's a great example where they were very thoughtful about the business model and the economics of that model, about where the pain point was in the provider-patient interaction. And as a result, it's a great product for both commercial patients, and they're getting incredible traction right now with Medicaid contractors and Medicaid patients. So
yeah, because it sounds like they're solving a really specific problem. Yeah, super interesting. Well, along those lines, are there still areas within women's health that you believe are, remain underinvested, even as the sector itself has matured a bit over the past 5 to 8 years?
Yeah, where do we start?
Yeah.
100%. I think the thing that we've been doing this since we started investing in 2019, raised our first fund in 2020. I think we have seen. In fact, we just had a deal meeting before this call, and we were observing how many more therapeutic opportunities we see today. When we started 5 years ago, it was mostly digital, mostly consumer, few devices, a lot of diagnostics. But over that 5 years, we have seen a change in the mix of investable opportunities and a lot more therapeutic opportunities. Recognize that, again, there are so many needs for women whose underlying health conditions have not been addressed yet. Endometriosis, PCOS, all kinds of complications of pregnancy, preeclampsia, uterine fibroids. So we are excited about the science that is now being applied to these underlying conditions that still impact women. And I think, I hope the next 10 to 15 years are sort of the renaissance for women's health, and that they finally have solutions that are tailored to them. So we haven't talked about our urinary incontinence. We haven't talked about our menopause symptoms. We haven't talked about our painful periods. And some of that's on us, because if something is visible, if something is invisible, then nobody feels like there needs to be a solution for it. But I think the more we talk about it, the more it is destigmatized, the more there's a recognition of, oh, wow, there's a big problem here. And there are, no solutions for that problem. So I'm excited about what the future will bring.
Yeah, no, and I think that is definitely the case, right? You are now seeing TikTok videos and Instagram influencers who are focusing on specific women's health issues, and sometimes in kind of a light and funny way, but they're talking about symptoms that they have, and they're doing so without stigma. And that in and of itself is really encouraging.
Yeah, agree.
All right, so let's turn to some more sort of, it may be more generic sort of founder advice. What is a question that you wish more founders asked you during sort of the early stages of their pitches with you?
So I always tell founders that you need to be doing as much due diligence on us as we are doing on you. What do we like to work with as a partner? Can I get references first to some of your other founders? Who can you put me in touch with who could speak to the value add that you bring to, in addition to your capital? Why should I want to work with you? It really needs to be, it's a partnership. And in venture, it's a long-term partnership. We're going to be married for up to 10 to 12 years. And so you really want to make sure that this is a successful business marriage. So I think, you like to think that you had the privilege of choice, and that you had lots of capital or options you can choose from. But even if you don't, you need to be very careful about who you are hitching your wagon to, because again, it is a long-term relationship. There are going to be ups and downs, and you really want to make sure that there is alignment and partnership, and that you can, again, as I say, do as much due diligence on your capital partner as the capital partner is going to be doing on you.
Yeah, it's great advice. I think that a lot of founders find themselves a little bit intimidated, and they don't want to push for a reference or push on questions that maybe might be considered difficult questions. But it has been a theme of this series and the investors that I've talked with that, that investors absolutely want to encourage founders to ask those questions and to figure out whether or not it's going to be a good working partnership both ways, right? And there can be small things that make a difference in whether a partnership works, and they can be very large things. And to the degree that both parties can find those things out at the outset, that's a good result for everyone. Mm-hmm. So as we wrap up, tell us a little bit about where and how founders can best connect with you. Should they get you by email? And we're happy to put that in the page notes here, or do you prefer text or LinkedIn? How can they reach you?
Yeah, so we have our website, Foreground Capital, has a pitch form, and that's really the best way to get into our flow, because that's our workflow, right? pitches come in there, they go into our CRM, we review them every week in deal meeting. You'll eventually get a response. Sometimes we have a little backlog of things we're screening. But eventually that is, as opposed to, coming into my LinkedIn, which I look at a couple times a week, but not frequently. And then I remember to move it from my LinkedIn into the CRM. And so there's just a lot of opportunities for things to fall through the cracks, where if it comes into the pitch form, it's in the workflow, and somebody on the team will look at it and hopefully you'll get a response. And as I said, sometimes you have to be a little patient. The other place you can always find us is at conferences. We were just talking about the Women's Health Investment Summit in Boston in November this year. A number of our team members will be there. It's a great opportunity to meet people and then follow up, because again, those conferences are not a good time for you to do a 30-minute pitch with me, but a good time to give me a 30-second overview of what you're doing and come in through the pitch form, remind me that we met there, and we can sort of again move through our regular deal process.
That's terrific. And I'm also going to be at the Women's Health Innovation Summit in Boston. So I'll look forward to connecting. I know a couple of your colleagues are going to be there as well. So that will be great. And founders, respect the workflow process. Go to the forum for sure. Okay, Stasia, is there anything else that that you would like to cover before we wrap today? Anything that I missed?
No, I just, I have such admiration for the founders out there doing the really hard work of, starting a company, building a company. I mean, we are also a startup venture fund. So we have been through, we're out in the market fundraising right now. So we have a lot of empathy for our founders and our entrepreneurs who are on this fundraising journey. And it is a journey, and you have good days and bad days. And if you have conviction about what you're doing, and you have really solid a business plan and a keen sense of the opportunity, just get up every day and pursue your passion.
It's a great note to end on. Well, I really appreciate the insights that you have shared with us today. And for the founders that are watching, I do hope that you will check out the rest of our series of interviews with other investors who have really shown themselves to be true partners to the founders that they work with. And at Nixon Law Group, we work with founders at all stages, and we help them to navigate the ever increasingly complex legal and regulatory frameworks that make up our U.S. healthcare system. And we are always creating resources to support that journey for founders. So feel free to take a look at those resources on our website or on LinkedIn. And definitely, please stay tuned for more conversations with VCs shaping what's next in healthcare. Thanks so much.